Welcome back, everyone. I'm Brittany,
And I'm Liam.
and this is the Doberman Dialogues. Today's episode is especially close to our hearts. We wanted to show just how manageable it can be to care for a diabetic dog, because one of our foster families recently faced this challenge with their foster dog, Klaus.
That's right, Brittany. At first, they felt the same uncertainty that many pet owners feel when they hear the word diabetes, wondering if they could really handle the injections and daily care a dog like Klaus needs. But with guidance from their veterinarian, fellow volunteers, and a consistent routine they became comfortable with, they watched Klaus bounce back stronger, healthier, and happier.
And now, as of November 2025, this sweet 6-year-old boy is available for adoption.
He's going to make his new forever family so happy.
Boy, that is for sure.
We at Dobie Foster Friends wanted to make this video to help anyone out there to feel confident also.
Because no medical condition should stand between a dog and a loving home.
Today, we're walking you through how to give an insulin injection to a diabetic dog using our foster superstar, Klaus, as the example.
Okay, so before we get started, we need to give a really important disclaimer, if you will. We are not veterinarians, and neither is our rescue, our production team, or any of our affiliates. We're showing you general, informational guidance only. If your dog has diabetes or you believe they need insulin, it is very important that you consult a licensed veterinarian first for the health and safety of your pet. Your vet will determine the dosage, timing, and equipment that's right for your dog's medical needs.
Exactly. Now let's get into the step-by-step process, starting right from the insulin bottle.
So first, get all your equipment ready and within reach. And once you do this several times, you will have your own system.
Make sure to wash your hands. Use a new correct type of insulin syringe, matching U40 or U100 insulin, and a fresh needle each time. Our vet recommended that we use the U100 syringe. Have a sharps container ready for disposal and, of course, a small handful of treats, too.
Once you are ready, the first thing is the insulin. The veterinary insulin specifically for dogs and cats is called Vetsulin, although some vets will prescribe human insulin. And if that is the case, you will need to work closely with your vet to monitor the pet's glucose levels. In our case, we use Novolin as per our vet's recommendation. Also, never shake the vial.
Yes. Instead, hold it between your hands and roll it back and forth softly. This mixes it without creating bubbles or make foam, which could inevitably lead to inaccurate dosing. Rolling keeps everything smooth and consistent.
One more thing, if you see clumps or persistent particles after mixing it, call your vet. Don't use it till you talk to them about it.
That is very important and is recommended by the Merck Animal Health website as well.
Next, take your sterile insulin syringe. Pull back the plunger a bit to make sure it doesn't stick. Next, pull the plunger to pull air into the syringe. Draw in air until you get to the specified units of insulin your dog needs.
Insert the needle into the vial, push the air in, flip the bottle upside down, and slowly draw out the insulin.
Make sure to go past the recommended dose by about 10 units, then push the plunger back in until you are at the exact dose for your dog. In Klaus's case, it's 11 units of insulin.
Most vet-approved injection sites are along the dog's upper back, the scruff of the neck.
Right, so gently lift that skin with your middle finger and thumb, then push in a dent with your index finger to make a tent.
So now, slide the needle under the skin at a shallow angle. A 30 to 40 degree angle should suffice. Don't go too steep. You don't want to go into the muscle. The dog might flinch. Once the needle is in, press the plunger steadily. Not too fast, but not too slow.
Then leave the needle in for a second or two so you don't get any leak back.
Good point, Britt. This helps ensure the full dose stays in the skin. Pulling the needle out too quickly can sometimes draw a little insulin back out. We want the dose to be accurate.
After that, remove the needle. And then our foster family gives Klaus a big, good boy moment and a treat. He loves peanut butter, or whatever makes your dog happiest. Positive reinforcement is huge and makes for a much more pleasant experience for everyone involved.
In a case like Klaus's, once he sees that peanut butter and the attention he is getting, he doesn't even care that an injection is imminent.
That's right. Klaus loves his before and after shot snuggles and attention.
The goal is to make this a calm, predictable routine, so your dog sees insulin time as no big deal, or even something positive.
Which is easy with Klaus. He knows he's about to get peanut butter and lots of love. Okay, now let's talk about disposing of used insulin syringes, known in the medical field as sharps. And this part is extremely important for safety. Because we're in Arizona, here's the method according to the Arizona Department of Environmental Quality. Put all used syringes immediately into a rigid, leak-proof sharps container.
And don't try to put the sheath back on the needle.
That's right, Liam. This is to keep the possibility of poking yourself to a minimum.
Exactly. Healthcare providers are required to not resheath sharps for this very reason. And that is why it's highly recommended for the general public as well.
If you don't have a commercial sharps container, you can use a heavy plastic bottle, like detergent or bleach, with a screw-top lid. When it's full, seal it tightly with tape. You can dispose of the sealed container in your regular household trash. Again, this is according to ADEQ and is legal in Arizona. Clearly label the container, "Do not recycle, household sharps."
Arizona also allows you to call local hospitals or medical centers. Many can give guidance, and some might allow drop-off depending on their policy.
Never place the container in the recycle bin and don't overfill it. You want to be able to close it and tape it shut. It's recommended to fill the container only about 3/4 full.
And definitely keep the container out of reach of children and pets.
There are also mail-back programs. These are regulated services where you purchase a prepaid sharps disposal kit, fill it with used needles, and mail it back for proper destruction.
They're legal in Arizona and most other states. So if you prefer not to use the home disposal option, this is a great alternative.
If you want to use a mail-back program, there's a link at the bottom of this video with phone numbers for companies that provide these special containers and packaging.
Just remember they only accept sharps containers they provide.
If you're listening from outside Arizona, this part is for you. Sharps disposal laws vary from state to state. Some states require drop-off sites, some require mail-back, and some prohibit putting sharps in household trash.
So please, check your own state's rules before disposing of any needles. You can call your local hospital, pharmacy, public health department, or check your state's guidelines online.
That about wraps up our overview of giving insulin to a diabetic dog and disposing of sharps safely here in Arizona.
It's simple as long as you, your dog, and your assistant, if you have one, are calm and reinforcing with positivity and treats. Remember, talk to your vet, ask questions, and make sure you're confident in the process your veterinarian recommends.
Thanks for watching our video. We hope it helps show how easy it can be to take care of a pet who has diabetes. Every pet deserves a family who loves them and cares for them with compassion.
That's right, Brittany. And remember, if you're interested in adopting or fostering a Doberman in the Phoenix area, reach out to our friends at Desert Harbor Doberman Rescue of Arizona. Please take a moment to visit their website, Facebook, and Instagram pages. The URLs are listed below. Don't forget to like the video, follow the podcast, and subscribe to the channel to keep up with our foster dogs.
On behalf of Desert Harbor Doberman Rescue of Arizona, Dobie Foster Friends, and A&M Web Designs, thank you for watching. Give your Dobie a belly rub from us and from Klaus. And, like I always say, behind every strong Doberman is an even stronger bond. I'm Brittany.
And I'm Liam. See you next time.